Nearly 30 million children visit the emergency room each year in the United States. The anxiety that a child feels each time they see a medical provider can be overwhelming. Lavette Shirley Elee is a board-certified physician assistant who works in a high-risk community with experience in primary care and psychiatry. She has written 3 children's books. Her motivation for writing is multifactorial. First, her desire is to address children's fears of going into the medical facilities. Second was her desire to introduce PAs to the younger generation in hopes for them to enter the medical field. Lastly, she desires for young girls to be confident and supportive of each other. All right, welcome, Lavette, or shall I say Dr. Elee. How are you?
I'm doing well. Thank you so much for having me.
Thank you. Thank you for being here. So why don't you go ahead and tell us a little bit about your story? I did some snooping around on your social media. I saw that we both share a very similar celebration. I don't know if you realize it or not, but I also graduated with my doctorate degree in December.
Oh, congratulations. Yes.
And the date for my commencement was on December 11th. So just a little bit, a few days sooner than yours, but I was just like, oh, yay, that's good. I love it. I love seeing women do what they do best and just, and when you wrote that terminal degree, I was like, wait, what? And then I see the pictures. I'm like, yes, that's awesome. So congratulations. Congratulations. But I know it was a long journey. It was a long way there. And it didn't all start with just, a spoon-fed story, right? So I know that you came from very humble beginnings. And so I want to just hear everything about you and who you are and how you got to where you are today.
Yeah, absolutely. Once again, thank you for having me and congratulations again. So yes, I got my doctorate was conferred on December the 15th. So I am very excited about that.
Nice.
But as you said, I was a military brat. So I'm from Tucson, Arizona. So when I was young, we did not have a lot of money, but we didn't want for anything either. But when I was 19, I did have my first son, Zion, who is now 18. So at that time, things got a bit more tough for me. So it was twofold though. So it was more difficult. It was more challenging, but I also kind of got that motivation for me to be great because I wanted to be that inspiration for my son. I wanted him to see me, even though I was struggling and that it was hard, that it doesn't have to be that way, that if you work hard, you can actually, be something, be someone. So while it was more challenging, it was also my motivation.
Yes.
So I moved actually once I had him to Ohio. And that's where I went through actually several different fields that I was interested in. So I first wanted to be a massage therapist, which would have been great. I ended up changing fields to nursing, where I took the NET test and passed it and was accepted into a class for nursing, but it wouldn't be for 2 years.
Oh, wow.
So with that being said, I would have completed that degree with my associate. So I figured, 4 years later, I might as well go for my bachelor's, right? So at that point, I transferred to Kent State University and was planning on entering into their nursing program.
Right.
But while I was going to school, I was also working in healthcare and had the opportunity to actually talk with nurse practitioners, PAs, physicians. And that's where I ended up kind of transitioning over to wanting to be a doctor, actually. So I was at Kent State. I actually completed my degree and was pre-med and molecular and cellular biology.
Oh, wow.
Yeah, which was awesome. I did great. When I was thinking about what schools I wanted to go to, I kind of looked at my son and I'm like, by the time I finish and I finish my, residency and all of this, I'm like, he'll be, nearly done with school, and I
Mhm.
want to put myself in a position where he can actually benefit from me finishing. So that's when I ended up transitioning over to becoming a PA.
Mhm.
So
Mhm.
yeah, so in 2010, I graduated from Kent State. I
Okay.
was accepted into PA school in 2012.
Dang.
Yeah, so I went
Yeah.
to Kettering College.
That's not bad,
Um,
2 years later.
yeah,
And the PA program is really competitive.
it is. It is.
Yeah.
Our program, I think it was about 4,000 applicants, or no, 400 applicants. I'm sorry,
Uh-huh.
400 applicants, and there were 35 who were accepted.
Oh
So
my
yeah,
gosh.
very competitive.
Yeah.
Yeah. So I
Crazy.
was blessed to have gotten into the program, especially my first time trying. So
Mhm.
very rigorous program. So I completed that degree, like I said, 2012. And I actually immediately moved from Ohio to North Carolina, where I am now.
Mhm.
So now I've been practicing in urgent care for
Okay.
the last 6 years. Before that, as you mentioned before, did some time in psychiatry, spent
Mhm.
a few more years in family practice than that.
Okay.
I've learned so much. And that kind of brings us, to today,
Mhm.
where I ended up writing my books last year in
Yeah.
2020.
Oh,
Um,
wow. That was
yeah,
a successful year for
yeah,
you.
it
3
was.
books and a doctorate, girl, you
I
were
know.
on fire.
And the whole purpose of that really was to kind of overshadow all the negativity with something
Mhm.
good,
Yeah.
because
Yeah.
we're going to all look back on 2020, and there's so much that we can look at that was negative that happened, that I
Mhm.
really wanted to do as much as I could to make it a positive year. So
Wow.
yeah, yeah.
Wow. All right. So let's discuss your years as a PA, and let's just say, what were some of the disparities that you may have seen as a PA? Whereabouts are you in North Carolina now?
So I'm in like near Charlotte, so
Charlotte.
in
Okay.
Matthews right now.
Okay. Okay. We are a former military family, and so we were out of Fayetteville and Fort Bragg. So,
Mhm.
but I spent a lot of time in Charlotte because my daughter was on a cheer team
Yeah.
at cheer competitions over there. So a little familiar with it. Okay. So, what were the types of disparities that you were seeing in like the Charlotte area or any of the areas that you've worked?
Yeah. Yeah, I've seen quite a bit. And that's one of the reasons actually why I love working in urgent care specifically.
Mhm.
So many of the minorities in general really do not seek medical treatment
Yeah.
unless it is absolutely necessary.
Mhm.
So, and that may be because of lack of insurance.
Mhm.
Also maybe because of fear of going to
Mhm.
medical facilities and not feeling that, medical providers are going to be looking out for their best interest.
Mhm.
So working in urgent care, we actually catch a lot of those people.
Mm.
And it's really just been amazing to really be able to sit down and have these discussions with people and say, hey, medicine is changing.
Mhm.
We are starting to look more and more like our communities that we serve, and
Yeah.
that we are here for you,
Mm.
and not that what you went through or what people who look like you went through before, we're not ignoring it or saying it didn't happen or doesn't
Mhm.
happen. We're saying it does, and we're working on it, and we're getting better.
Exactly. Yeah.
So it's been amazing. I specifically work right now in Monroe, North Carolina.
Mhm.
So we see quite a bit of that. So it's just been honestly life altering being able to do that. So I love my work there.
Oh, that's amazing. Well, thank you for doing what you do and serving
Yeah.
your community. I think it's incredibly important, and I'm happy that you touch on this topic because I think it's coming up a lot more now with COVID and the vaccinations and everything. Is the types of, I guess, misunderstanding that a lot of people in ethnic communities believe that are being kind of, okay, so my cousin is married to a Haitian guy,
Mhm.
and one of the conversations that they've had before is that he tries to explain to her, no, in our community or my family believes that the vaccinations that are being given to Black people are not necessarily the actual COVID vaccine that was approved. And so
Mhm.
I said, and then so she comes back with me with that, and I was like, no, like there are so many like ethical issues that is wrong with that, like. I understand the fear and I understand the misunderstanding, but I just please tell them like that's not the case and that this is very highly regulated and we are not doing any Tuskegee projects here. This is it's done, it's over with. We've learned from that huge mistake many, many years ago. And people like you and I, we are getting the same healthcare that everybody else should be getting.
Yeah.
But there's so many misunderstanding about that. And I think there's a lot of room left and opportunity left for us to like just put it back out into these communities and say, listen, here we are, we're people of color, and we're here to tell you that we are here to serve you and that medicine and science can be trusted.
Yeah.
And we have laws in place for that. So thank you.
Absolutely, of course. Yeah. So, and that's really an important topic, that, we are here. We are here to help. We're not here
Mhm.
to hurt or harm anybody. I have been asked about that many times, with even the COVID testing, where are you putting something in my, brain, or,
Oh
things
my
that
gosh.
you
Yeah.
think are really out there, but people are honestly thinking,
Yeah.
and I'm like, it is just a Q-tip, I promise we're not doing anything to harm you. I've
Yeah.
had the tested myself. I've been vaccinated. I saw you have been too.
Hmm.
So we're all getting the same vaccinations.
Hmm.
And one of the other big things that we'll hear, of course, is that, this happened so fast. There hasn't been long enough, it hasn't been tested. But we're not starting from ground zero with vaccinations, and that's
Right.
what I try to explain to my patients. And because
Mhm.
it was quick does not mean the trial was not rigorous,
Mhm. Exactly.
clinicaltrials.gov. Take a look at it. If something is actually still in a trial, it's
Mhm.
going to be there. You can read what they did.
Mhm.
And that both the Moderna and Pfizer vaccines are well studied, are still being studied, but the
Yeah.
trials are rigorous. There are a
Yes.
lot of people. They're multi-centered. They're placebo controlled. They're blinded. So it's just they're both very good studies. So
Yes.
believe in science, because it will lead you in the right direction every time.
Yes, yes. Thank you. Oh my goodness, I'm gonna have to air this way sooner than than anticipated. I think it's such an important, relevant message right now
Yeah.
that and now that, we're starting to see the shortages that we're seeing nationwide, maybe even internationally,
Hmm.
that it's, now we want it. And those of like my staff members who when we were doing it at our hospital, who were just kind of hesitant, a little on the reserve side about not wanting to be the first ones to go out there and get it done. But then now realizing, well, there goes my chance. I don't know if I'm going to have another opportunity to get it done,
Yeah.
before the whole country's been vaccinated and then it's finally my turn, And so it's scary, but I definitely think that everything you have to say, thank you so much for the information and the resource. And
Absolutely.
everybody needs to hear this. Everyone
Absolutely.
needs to hear this. And so awesome. Thank you.
Thank you.
So, Lavette, what would you tell yourself, your younger self, if you had the opportunity to go back to your 17, 16-year-old self?
Yeah, so that's a great question. So I would say that, nobody has the foresight to know, who you will be.
Mhm.
And even, in the toughest of times, and when you've made mistakes, which, those are things that I don't call mistakes because they're motivators for me, but
Mhm.
um, it doesn't mean that you're gonna, and even though it's gonna be harder, it doesn't mean that you're gonna fail.
Right. Yeah.
So just keep pushing forward. And that is the biggest message I say to myself. Keep pushing forward, and don't believe what anybody has to say who, has something negative to say about you. You're going to be great. You're going to be just fine.
Yeah. Yeah. You're never a victim of your situation. You can
Yeah.
always change it. You can always rewrite your story.
Yeah.
100%. Thank you so much.
Of course.
So, what is it that motivates you? I know you'd mentioned your son was one of the biggest reasons,
Yeah.
but I'm hoping there's a lot more to express on this topic because I feel like you have taken similar journeys as I have in just doing what you're doing and beating the odds and breaking the molds and not being a statistic. So what motivates you?
Yeah. So you're absolutely right. So my son, both of my sons, I have a
Oh,
2-year-old as well.
oh
So,
yay.
yeah, the big one and little one, and my family. But it's also just that little girl. Like when I was young, I just did not have a whole lot of confidence.
Mhm.
And I didn't have people telling me that I could be
Yes.
anything more than, pretty, or, it was
Mhm.
very, very limited as far as what my dreams should be, just kind of based on what other people have done who look like me.
Yeah.
So it really motivates me to see a young girl, especially, who is struggling with that, who doesn't really have a lot of positive influence, to see me and hopefully, aspire to be something greater. And that's what really motivates me.
Yeah.
So I will give you a few examples.
Right.
Right where I work at now, when I walk in a room and I see a young girl and she says, "You're my doctor,"
Yeah.
"I'm your PA. I am who you're seeing today."
Yeah.
And their eyes just get really wide and they're
Oh,
wow,
yeah.
there's just not, I don't know, there's not much many greater feelings than that. So
Yeah.
that really motivates me to keep going, to continue seeing patients and to realize that I'm doing what I was intended to do.
Mm-hmm. Wow. You are in the right place. Thank you. Thank you for just, I can't thank you enough. And I think it's so incredibly important that little girls can see faces like you when they go to seek medical care, or they can turn on the TV and see somebody with their right hand on the Bible, or is it left hand on the Bible, right hand up, and being inaugurated as
Yeah.
VP. And so I think that's so incredibly important. And it's 2021 and things are changing, and and we'll get into your books in a little bit, but I know that you also like promote a lot of this as well in those areas. But before we start getting into your books and everything, I just wanted to know, like, what was one of the most difficult decisions you've had to make in order to fulfill your destiny?
That's good. So spending time with my family, as I said, is so
Mhm.
important. And sometimes I do find when, working full time, in the urgent care and also trying to balance things that I love to do, like writing books. And now I'm collaborating with other providers on writing books. Balancing that time with family as well, and making
Mhm.
sure that I'm here and ever present like I need to be. I have an 18-year-old, and it sounds like you can kind of, for some people, they may think that means it's less responsibility for you, but it's more,
Mhm.
especially now, so
Mhm.
you got to keep an eye on them. So
Mhm.
really that balancing act has been really difficult for me.
Mhm.
But recently I have made some changes to kind of rectify that.
Okay.
So I will still be kind of doing everything, but I will be pulling back a little bit on some things with work, just to make sure that I'm able to be here for my family and
Yeah.
continuing to do what I love, because I'm
Mhm.
getting too old to do what I don't love. This is what I
Yeah.
love to do. So this is what I want to do. And I'm going to focus more on that.
Yeah, yeah. And you know what, Lavette, I'll tell you that we met during our meet and greet back in November. So it's been a while. And
Yeah.
then I saw that you booked this date and I was like, why is she booking it so far out? And then when I saw that you were conferred, I was like, well, that explains it.
Yeah.
And so I think you're there, like you're doing a great job with balancing what you need to balance. And you're just like, okay, yes, this interview is important, but it's not important right now. So it's gonna have to wait until I'm ready for it. And so I'm happy that you're here and you've taken time to see me today, but it's definitely showing that you're working on that balancing act and making
Yeah,
sure that you're available to your family and to yourself.
absolutely.
All right, so let's talk about those books that you've written. Let's discuss those. You've got a few books written.
Yeah.
What are they, and what are they about?
Yeah. So my first book is called "I Saw My PA Today."
Mhm.
So I'll now give you a quick preview here, so that one's
Ah,
here, if you can
okay.
see. There you go.
Yes.
So this book, I was really motivated to write it, because I see a lot of kiddos in the urgent care, and they are pretty much always terrified to be there to see me.
Mhm.
So the first thing I wanted to do was kind of, write a book that would kind of take them along their journey of what may happen in an urgent care setting, give them the names of the people who they're going to be seeing, and
Mhm.
kind of help to quell their fears of coming into a medical facility. But I also wanted to, when I was looking at children's books, I didn't really see any children's books that really had PAs in there.
Mm.
So really introducing the younger generation to different aspects of the medical team, because we are
Mhm.
there, we are helping, just like nurse practitioners, seeing patients, and we're there ever present, especially with
Yes.
COVID, we're we're in every specialty, every field. So just
Yeah.
introducing children and their parents to PAs really was my objective here.
Mhm. That's great. That's great.
Yeah.
So before we go into the other ones, I just want to know, like, what resources did you use, or what if somebody was very interested in doing something similar to what you're doing, writing a children's book and authoring that? How did you find an illustrator? Did you illustrate? Like, what were some of the steps that you took in case there's somebody out there who's curious on your journey and would like to have a similar path as well?
Yeah. So for me, I just went ahead and wrote the words down. Like first, I just wanted to get all the content there, and then it
Mm-hmm.
really was just searching online. So a lot of information on YouTube about publishing. My illustrator I found on Fiverr, which is
Okay.
great because they're just freelance artists on there. You can
Mm-hmm.
take a look at their work and just decide if they, you can decide if it's somebody whose work that you like or kind of fits your area or what you're doing.
Mm-hmm.
And then you can actually have them draw a few pictures for you, decide if you
Mm-hmm.
actually like their work, and then you pay them there. Works
Yeah.
very well. Um, and other than that, the only other thing that I did was on Facebook, I joined several groups for
Mm-hmm.
authors.
Yeah.
And that has been so helpful because they've
Okay.
been there and done it. So anything that you need, any advice you need, you could actually find illustrators, editors,
Mm-hmm.
publishers on there. So you really connect with so many people who have done what you're trying to do. And I
Mm-hmm.
think that is really probably the first step that I'd recommend for anybody to do. I didn't know that at the time,
Mm-hmm.
but there are people that are willing to help you, give you feedback, even read what you've written and kind of let you know, uh,
Yeah.
maybe you should go a different direction or not. There are people who will take a look at, your cover photos and just really help you with every step of the way. So
Okay.
yeah,
Okay.
been
Awesome.
a
Awesome.
great.
So let's talk about those other books that you've written.
Yeah. So the second book that I wrote is actually called Remarkably You, Remarkably Me.
Okay.
Totally different.
Yeah.
But at the same time, I guess overall my goal is to empower children. So for
Mm-hmm.
this one, this was kind of for that little girl again that we've been talking about. So
Yeah.
me when I was young and really kind of lacking that self-confidence,
Mm.
this book was really written for that girl in hopes
Okay.
that other young girls will read it and
Mm-hmm.
kind of gain some self-confidence.
Okay.
The other aspect of this is it's not only about you being confident in yourself, but it's
Mm-hmm.
also about you being so confident that you're able to actually support other girls and women. Okay.
Mm.
So that's kind of the second part of the book. So what it actually is an affirmation poem that I wrote that I actually just turned into a children's book. Um,
Okay.
so it's just very positive, all about just affirming who you are so that you
Mm-hmm.
can actually support other girls and women.
Oh, wow. Very nice.
Uh,
I love it.
this is probably my favorite because I am a poet at heart, probably
Yeah.
more than just a writer. I've written poetry for a very long time, but this is the first time I've ever actually, put something out there in the world to potentially be judged on. So that was actually hard for me to do.
Yeah.
But I've gotten a lot of good feedback.
That's great. That's great. I recently interviewed, and hers will probably air after yours, I believe, because we're aligning hers with a specific month. And so her interview, she was also a poet as well, and she had a very traumatic childhood growing up, and so a lot of her way to release the anger and release the frustration and have a voice was through poetry. And so
Yeah.
she shared some of her poem, and oh my goodness, it's amazing what you can do in poetry. And so I'm actually really excited to get that book and read it and then gift it to my favorite little girls around me.
Yeah.
But it's definitely it's magical. It's really magical to take poetry, put it on paper, and then like publish it, and then feel so vulnerable in that process, like you were saying, and not knowing how are people going to judge you
Yeah.
on the other side. But
That's hard.
that's courageous.
Thank you.
All right. So what about the other ones? Any other books that we have?
Yeah, so the last book I've written
Yeah.
that's been published is My Primary Care PA.
Okay.
So very similar to the first, but it's a young boy who
Mhm.
actually goes to his primary care physician, and he's actually being seen. And he's just kind of confused. I feel fine. I haven't had an injury. I've gone to the bathroom, peed. Like there's nothing going on with me. So he's like, why am I going to see this provider?
Yeah.
So he goes, he has a visit. He actually has a blood draw in there, but he does okay. He's courageous. He has really nice, PA and,
Mhm.
MA that take care of him in
Mhm.
the book and just does a great job. So, and these two books, because I've worked in primary care and I've worked in urgent care, were just
Mhm.
kind of about, me and experiences that I've had.
Yeah.
And going forward, the plan is to work with other providers because, of course, I haven't worked in every single specialty out
Yeah.
there.
Yeah.
And I really want the books to be like a real encounter, a really realistic as to how the
Mhm.
a child will interact with that provider.
Yeah.
That's where we're going now.
Okay. Wow. That's
Yeah.
amazing. I love that. I love that.
Yeah.
So, do you already have like a specialty area that you're thinking of that you're like, okay, this is the first and second, or do you kind of just want to see who you can connect with first and start with the first resources you have?
Yeah, so I've already been in contact with several different providers across the country, so it's really awesome. And I am
Great.
actually working on that next book now, so
Yeah.
that should be out in the next few months.
Oh, that's so exciting.
Yeah,
Well, you just knock them out. You make it seem very easy. And I feel like I've been wanting to do children's books because I work in pediatrics. And so
yeah.
it's like really
Oh,
exciting.
wonderful.
And I think there's an opportunity, like what you're saying, with like just getting the message out there and letting
Of course.
children and families know, help reduce some of that anxiety of
Mhm.
entering or being diagnosed with something or any of the above. And so I've been curious and I've been in those Facebook groups that you've mentioned. And I'm just kind of like a fly on the wall watching and learning and watching and learning. And here you are knocking out three in 2020 during a pandemic. You already got another one on the way. Like you are overachieving here. Like
Thank
you're
you.
making me seem lazy over here. Like I should be doing something more. And you got your doctorate. Come on now. You gotta
Thank
stop.
you. It's
No.
I think it's really just about getting started. I think once
Yeah.
you get started, you're good to go. And
Right.
being that I'm like a poet, like I love writing poetry and the books rhyme. It's like once you actually get started, it just kind of flows out of
Yeah.
you and you're good to go. So just
Right.
get started
Okay.
and you'll
That's
finish.
good advice. That's good advice.
Absolutely.
Just stop being complacent and just do it. Stop overanalyzing. For sure. Okay.
And then
So
any ideas that you have, too. And I think this has been useful for me because I mean,
mhm,
for years that was me. I'm like, that would be an awesome idea, but I forget it, things like that. I just write it down
mhm,
now. Any ideal I have, I make sure I jot down and
yeah.
so it's there for me to utilize later and grow on.
Okay. Yeah. Yeah,
Yeah.
that's great. That's great. Especially when we have tablets and notebooks and
Yeah.
smartphones at our fingertip. It's not difficult anymore to just have it there and then revisit it, whenever
Exactly.
you're ready. So, all right. So, what inspired you to write the children's book? Was it your experience as a PA? Was it your experience growing up and not having or not being as exposed to the medical field?
So it was my experiences as a PA that kind of I gave me the idea, but what
Mhm,
motivated me to actually start writing
mhm,
was the pandemic. So, like you said, just with the other person you were speaking with and had the interview with, I was just riddled with anxiety the beginning of last year.
mm,
We had this pandemic, we had this virus going around that's killing people. I'm like, I don't
mhm,
know, we don't know a lot about it. And, I wasn't able to stay home. Like I had to go to the urgent care and I had to, lay my hands on people who may or may not have this virus.
mhm,
There were all these concerns about getting PPE and
mhm.
just I needed to put my anxiety into something.
Yeah, yeah.
So when I was younger, like I said, I was a military brat. And when I was 14, my um, parents, my mom, my stepfather, and my brother, my older brother who I lived with, moved to Japan.
Mhm,
Um, and my older sister who I lived with moved to Ohio. And I was like, ended up moving with my dad and stayed in Arizona where we were at the time. And
mhm,
that was the time where I just really had a lot of stress and anxiety. But I was too scared to leave because I was 14 trying to make a decision like that. And
mhm.
that's really when I started writing initially.
Okay.
So, fast forward to 2020 and I had this really stressful time again. I went back to what I know. I started writing
Yeah.
again.
Oh,
So
wow.
initially it was just me writing, just writing
Mhm,
something. And I'm like, these are the things that I'm seeing, other than the pandemic. I'm seeing these scared children in the urgent care. And then
mhm,
on my, PA groups and medical groups online. And I'm, hearing about the lack of advocacy for PAs. And I'm hearing about, just people not knowing, who we are. We've been around for, 50 plus years.
mhm.
So I just kind of put all that together. And that's where I saw my PA today from.
Oh, wow.
Yeah.
That's awesome. I just had this epiphany moment while you were speaking.
Yeah.
And so English is my second language, and my
Mm,
first language was Vietnamese. And so
okay.
I'm sitting here thinking, I didn't have this opportunity growing up having health insurance.
Mhm.
And anytime we had a situation, my mom took me to like a primary care doctor, but it was like I've had like maybe two visits ever in my entire childhood.
Oh, wow.
And it wasn't until I joined the military that I actually had healthcare. And I'm like, what? You mean I can come to you because I have a runny nose? Like, it's like, and so it was so different for me realizing that like this resource is here and available to us, but we didn't have it growing up because my parents didn't understand the medical field and didn't understand what it was like to take your child to visit. And I never knew what the inside of an emergency room or urgent care center looked like until I
Yeah.
started working in one, And so way different, but I just had this epiphany moment that like not only can I pursue what I've been thinking of doing with children's book, but I think there's an opportunity in like another language in using it in a different language.
Great.
And
Yeah.
then something for you to think about too if you're curious and like getting some stuff translated. Like I think this is really powerful stuff that we can actually get out there into the communities and saying, wow, we just had like an aha moment
Yeah.
here.
Yes.
Yeah.
Great minds, you gotta come together with people who are doing things and
Yes.
you
Yeah.
grow, that's awesome.
Wow. All right. I'm really pumped now. I got to start writing things down and then go, here, mom, translate this. Like, I don't,
Exactly.
my mom's better at that.
Okay. I know a little bit of Spanish, that's about it.
Right.
And not enough to translate anything important.
Yeah. But you know what? But there's lots of Spanish speakers around us, right? Especially like
Oh,
with
yeah,
me here in
me and
Miami.
my sister,
There's
yeah.
tons. There's lots and lots of opportunities to like go completely international with these books. Just a thought.
Oh, that's awesome, yes. Yes. Oh, yes. I love it.
So, Lavette, what has your writing journey taught you?
Yeah, so I guess one of the biggest things that I have learned is that support sometimes will come from the most unexpected of places in
Mm.
people,
Hmm.
and opposite of that is that if some of the people that you thought would be very supportive are not, and you don't know what the reasoning is, you have no idea, but that is just something that you learn, and you
Mhm.
learn to move forward. One thing I've also learned is that, really no matter how good you feel like your work is, you always can learn. In that when people have, when you have negative feedback or negative comments or reviews, that you want to just take that in and learn from it and not get too offended.
Mhm.
So I spend a lot of time. I've gotten a couple of, negative reviews, and I will always go over to like Maya Angelou or one of these people, and I look at some of their reviews and I say, okay, if
Yeah.
she can have a bad review, then I can too. And
Oh,
I'm
yeah.
gonna I know I'm gonna take it and I'm gonna learn from it. But
Mhm.
that's okay. So those are some things that I've learned.
Yeah.
Yeah.
What one of the podcast pages that I follow, the moderator on there says, like anytime you get a bad review, screenshot it and post it here so that we can all just laugh about it, and just laugh about how silly it is. And that
Yeah.
was probably like the most like wow thing for me to see that like and I didn't see the initial post. I saw the response to it. Like I saw the action that happened behind it. So I
Yeah.
saw somebody with a screenshot and I'm like looking and I'm reading the screenshot before I actually read what the person wrote in the comments. But she had said, the moderator had asked if we have a bad review, just screenshot it and post it here to laugh. So here I am laughing with you all. Please laugh with me. Like it was just so cute and
Yeah.
funny, but it was making like just not taking it too seriously, I guess.
Yeah.
And then finding a community of people who understands too that yeah, sometimes people just want to write really stupid things
Yeah.
on there and
Yeah.
or mean things or irrelevant things. And I'm just like, I have another YouTube channel for my side gig, and one of the posts on there was like, "This is clickbait. How can you do that?" I was like, "Did you even watch the entire video? Because if you watch the entire video, you would understand the message that I'm trying to relay." And it was just like this back and forth banter. I'm like, why am I even wasting my time?
Yep.
Why am I even wasting my time? This is so not worth it.
Exactly. And I honestly should have learned from like reviews that you get, you know, in the medical field, because some of the reviews, I remember one year, and this was several years ago, I got a bad review because I wore a mask during flu season in the room, and the patient just didn't understand why I wore that mask, and they
Yeah.
were really upset. And I'm like, You just can't make everybody happy. So
Right. Wow, that patient really was taking personal offense to that.
yeah.
That's crazy. I know exactly why you did, but I know exactly why they're complaining too, because I've heard
Yeah.
it before. I've
Yeah.
heard people on the inpatient side like, prior to COVID, everything pre-COVID, but it was just, why is she wearing a mask? Well, because if she didn't get the flu shot, she needs to wear a mask.
Yeah.
That's just part of our hospital policy. And it's not because she's trying to offend you and think that you have something extra that's,
Yeah.
that's not there. So it's craziness.
That's
So
totally right. Mhm.
I'm going to jump back a little bit to just kind of your PA career, and so I know you're a huge advocate to teach more children about PAs in the medical field and that the various differences of the roles and everything that everybody has. So if somebody came to you and said, "I'm curious and I am interested in becoming a PA or learning more about it if it's right for me," what are some of the resources and the directions and the advice that you would give them?
Yeah. So, hey, I'm available. You find me, I will talk to you myself. But the first thing is really understanding what a PA is. So,
Mhm,
PAs are going to be medical professionals.
mhm,
We are able to diagnose, treat illnesses, develop and manage treatment plans, and sometimes we are a patient's primary medical professional that they see. Okay, so we are involved in every specialty, really that there is. Some less than others, but really in every specialty we will find PAs there.
mhm,
So we take medical histories, complete physical exams, diagnose and treat illnesses. So, we are going to order, interpret tests. We work inpatient, outpatients, develop treatment plans. So, one of the best resources that you can go to is really aapa.org.
mhm, mhm,
That's really where I would say to go ahead and start and then kind of branch out from there,
mhm.
because you're going to have all information about the schools you can go to, exactly what we do, and then do your research really on all the aspects of what PAs can do and how we're kind of we can transition into different specialties. And I think that's really where I really chose myself to become a PA, because there's all
Mhm,
sorts of different parts of medicine that I like.
mhm.
I'm interested in allergy. I'm interested in infectious disease. I'm
Yeah,
interested in OB. I'm interested in dermatology. And if at any point in my life I want to get into those specialties, I just have to apply and
yeah.
learn on the job.
Okay,
Yeah.
great. Awesome. So what advice would you give somebody who's now done with their undergrad? And I know that it requires some clinical time or background before applying for PA school. And I
Yeah.
only know this because my husband was on the PA track, but
Yeah.
now he's on the med school track.
Yeah.
So we've done a lot of research into it. But what would be some advice for you? I know it's super competitive getting accepted into a PA program. So
Yeah.
what are some things to make them a stronger candidate?
Yeah. Yeah. So, I mean, you do your clinical hours. So, working as a medical assistant, EMT, like on the basic track, would be a way to go.
Mhm.
Um, so, those are some reasonable things for you to do to kind of get those hours. Make sure you do plenty of shadowing.
Mhm.
And then I always say, to be a PA, you don't have to get a degree in biology, like I did. For some candidates, they stand out because they have a degree in something that, like music or something, great like that, and then you just make
Mm.
sure that you get your, chemistries and biologies and those things that you need to do, will
Right.
help you stand out. For me, what I did, I was pre-med, so I did a lot of extra coursework. So I took courses in immunology,
Mhm.
even though I only needed organic chemistry. I believe one, I did organic chemistry two as well.
Mhm.
I took some extra courses just to ensure that I was, a strong candidate and that I really stood apart. So that's something that you can certainly do as well.
Okay.
And make sure your extracurriculars are there, also. So do, volunteer work,
Mm.
make sure that you really have strong references. So
Mhm.
there's definitely a lot that you can do. But another great, resource, make sure that you go to the school and know exactly what their requirements are,
Mhm.
as well. So each school has different requirements, and,
Yeah.
and really be, aware of what those are.
Okay, great advice, great
Oh,
advice. And I think something that a lot of people often miss on is the volunteer aspect. I think
mhm.
that's it's huge when I'm interviewing nurses who are new graduates and
Mhm.
I've got 200 candidates who want these 5 positions and I have to narrow it down to the top 5. I'm definitely looking at. They're all coming from the same schools. We have X amount of schools here in Miami. They're all coming from the same school. They all come with um, great reviews from their great references, and I'm just like, okay, but what makes you stand out? So those volunteer things that they do, those extra, like just going above and beyond and doing things outside of what's expected of you and just doing it because you want to for the knowledge, for the growth is so important. And I think that volunteer is really, really big. And so, if you're a volunteer, guess what? You get like one extra check mark on yours as opposed to what somebody else is just because of what you've done. So yes.
Absolutely.
Great, great. So one of the questions that I have on here for you is what's your plan in store for the next 6 months? So we know your book's coming around really, really soon. And I feel like probably there's even a second one in the next 6 months, but why don't you tell us what your plan is in the next 6 months?
Yeah. So as I said, it's going to really be all about collaboration. This is my year of collaboration. That's what I'm calling it. So I just want to, and I'm so excited about it, just meeting with medical professionals across the country and really talking to them and shedding a light on what they do, like what their part is in the medical team so that people understand exactly, what they do and their importance. So really highlighting those things. So that's going to be one of the big things that I do. The other thing is, trying to move as far as my career is concerned more into an education role. So I'm working different aspects of that right now. So not too much I can share right now on that, but
me too.
I'm working different aspects of that. So I do want to move more into the educational realm. And I am very excited about that because I will tell you one of the things that I enjoy the most about, what I do now, because I shadow pre-PA students. And it's great. I learn so much from them, but it's really nice and fulfilling to see that light kind of going on and them like learning something new that they just didn't know and just kind of solidifying their desire to be a PA. And so that I just love it. So moving into that educational role for me is just it's really key. Key to my happiness and balance in my life. So
Yes, I love it. I love when students come by and they're just shadowing or they're student nurses and they're just so eager and they're just huge sponges wanting to absorb everything. And I'm like trying to regurgitate as much as I can and, give them the do's and don'ts of nursing, but then give them the do's and don'ts of life. And I'm just like, I'm so eager to just like shed light on them and give them more knowledge because they're the new generation of professionals, and we want to have the right ones. But then I find too, and I don't know if you're seeing this in your area and stuff, but I find that, or maybe not necessarily for you, but for us on the nursing side, our nurses, our younger nurses, our millennials and our Gen Zs are so eager that they are in and out of nursing so fast. They go in, they graduate with their bachelor's, they come work. Within 6 months of working, and they're just barely on the floors on their own, they just registered for school, and now they're back in school for their nurse practitioner. And then next thing you know, 2 years later, they're only like 2.5 year seasoned nurse. They're now nurse practitioners, which is great. I love the ambition and I love the drive, but not when everybody's doing that, because I learned too that, education is also a business. And so the universities have to make money and they're very, very hardcore recruiting. When you're coming out of your bachelor's, remember, come back for your master's, remember, come back for your doctorate. And they're recruiting just as much as we are recruiting nurses to come and join us at our hospital. And so we lose them so much faster at the bedside. And then now forget it with COVID, like we're losing them left and right because there's just so much more money in travel nursing than there is working your normal job at your home hospital, in your community. And it's sad. So we're losing them very fast.
Yeah. And it's just so challenging too now, so I just can imagine, the nurses and dealing with COVID and, it's so much more work now and you're not getting more of a salary, you're, as a matter of fact, for some of us, their jobs are on the line, since COVID. I know it makes no sense, but it's what's happening.
Exactly.
You're working harder and you're more anxious because you don't know if you're going to have a job tomorrow. So I just see it, moving into something else where you're making more money and you're not inpatient. I mean, that's got to be tough. That
Mhm.
it's actually been surprising for me on my end, because I honestly was thinking, I'm like, gosh, with everything going on and all this, with COVID, I'm surprised students, I'm thinking we're going to lose a lot of interest, but I feel
Mhm.
like I've had more interest in being a PA since this
Oh,
started. Like, there's people who just want to help and, want to know more information. So
that's
they figure this
good.
is the way to do it. So I'm like, well, that's
I
great.
know. Yeah. No,
That's
that is
awesome.
really, really great. That's awesome. And
Yeah.
like here I am as a mother and I have a 15-year-old that, 2 years ago I was able to tell her, well, growing up she always wanted to be a NICU nurse like mommy. And then and then at some point in time, I guess I pushed her away from the nursing field because I think as a pediatric nurse, I'm like, no, don't do that. I've seen an elbow fracture based off of that. No,
Right.
don't do that. I've seen a burn victim. Like it's like I've always had trauma examples because I worked on a trauma floor
Yeah.
for a little while too. And
Yeah.
I've always had like these crazy examples of what can happen on a playground
Yeah.
or while you're out camping or like whatever crazy like endeavor you're doing and just like the crazy freak accidents that happen as a result of it. And so I think I like overdid it as a mother. And then I'm like, don't do this because this can happen. And then I'm always giving them bad examples and it scares the heck out of them. But my
Yeah.
daughter, eventually she was just like, okay, but I want to do this. And then I was like, okay, she's a really mouthy girl. So I was like, maybe go to law school. You're good for that. Like you like to fight back. You like to argue. You're
Yeah.
good for debate. And then and then I was able to convince her, like, maybe you should go to medical school,
Yeah.
maybe like, cause you like, she said, I love science, this and that. And I was like, oh, well, what's good for science is medical school. Like you're going to do great. It's going to come naturally if you enjoy it now. And of course, she did the medical tract for the Magnet program at her high school. And she ended up having a teacher that she did not like.
Oh,
And it just breaks my heart. Just one person. It took one person to make her think this is not for me anymore. I
yeah.
don't like that woman. And she was a terrible representation. I'm so mad
Mm.
over that. I am so, so upset over it.
Yeah, that is one of the most frustrating things to me, when it comes to educators,
Mm.
because you make so much of a difference to children. And I have this conversation with my son, like I said, who's 18, all the time, because now I'm not good at science. I'm not good at math. He's like, there's no way I can do anything in the medical field. And you know, looking at some of the teachers that he's had, I'm like,
Mhm.
I try to explain to him that even for me, like when I was in high school, I was the same way. I'm not good in science. I'm not good in math. I
Mhm.
didn't have really great teachers. I had nobody motivating me to be great. I really didn't study it because I'm just like, I just am terrible at it. So there's no point. So once I went to I went to Tri-C actually in Cleveland. So I went to a community college first.
Mhm.
And I will say the first math teacher that I ever had who actually taught me that there were more than one way. There's more than one way to actually do each math problem.
Uh-huh.
And you just find the way that works for you and you'll do fine.
Yeah.
And it's funny how when I was taught a way that I could actually learn and it worked for me and I
Mhm.
did it, I suddenly was good at math. Suddenly I
Mhm.
have teachers who are teaching me, teachers who are actually excited to be there, not just kind of thrown in an area to teach
Yeah.
subjects. Um, I, just- I suddenly was good at math and science. I suddenly had straight A's. How did
Mhm.
that happen? I'm the same person, you know?
Yeah.
So it's just teachers can motivate you to something that you didn't realize that you can do, or like you
Mhm.
just said, they can actually completely just take the wind out of your wings.
Mm.
And
Mhm.
unfortunately, sometimes kids never recover from that because they just feel like they're not good at it. And that is one of the most frustrating things that I really have experienced.
Mhm.
And one of the reasons why I want to become an educator, because that is just the opposite of me. Like, I do not want to
Mm-mm.
demotivate anybody. And I feel like
Mhm.
all these, you have so much potential, and a lot of times you just need to kind of find a way to tap into it.
Yeah, yeah. Yeah, we're gonna have to revisit that conversation, man, because 'cause I'm so upset over it,
Uh-oh,
and
I think you're
it all
frozen.
Can you hear me? Can you see me now?
Yes, I can,
Okay.
ma'am.
Okay, perfect.
Yes.
No, I'm so upset over that, and so I'm definitely gonna revisit that again
Yeah.
when the subject's not as sensitive to her and see because she's only a sophomore, so there's still time. There's
Yes.
still time. All right. So, Lavette, if I gave you a billboard, what would you put on your billboard?
Ooh, my family. I would put on there, gosh, that I'm a Christian, that I have an awesome support system. So I've definitely put
Mhm.
them on there. My sisters, my brothers,
Mm.
my friends that I've grown up with and been friends with since I was I have friends from middle school,
Mhm.
which is interesting because I lived in Arizona, moved to Ohio, moved here. So some of those relationships still have lasted through all of
Mm,
this.
that's amazing.
I'd put them on there for sure.
Oh.
And then, gosh, some future things, I put on there my cap, that is
Uh-huh.
something that has been amazing, or amazing kind of experience that I've had recently.
Mhm.
The fact that I've graduated with my doctorate, so I put that on there. Um, yeah,
Mhm. There you go.
that would be right there front and center because
There
I've
you
I've
go.
just aspired to, achieve that for so long.
Mhm.
And there was definitely times where I didn't think I would. So that's been just huge for me,
Yeah.
that I would be called doctor one day. And having my son at 19 and really seeing a lot of people who have kids so young, um,
Mhm.
who really don't go very far in education. I said that is something that I was going to do.
Mhm.
And though there were doubts, from myself and from others, just achieving that goal last month, it still seems unreal. So that would definitely be on there.
Yeah, absolutely. No, congratulations. It's a huge, huge undertaking, and having, the background and thinking that you could have just stopped at 19 and was like, all right, well, this is my destiny. This is where I belong. But you didn't, and you persevered, and you went beyond what the statistics said that you should be, or would rather be have you at, right?
Yeah.
So that's amazing. All right. So, Lavette, sometimes we don't know what we don't know, and I may not have asked you a question that you wanted to have asked on this interview. Is there anything that you wanted to bring up?
Um, I don't know. I feel like we discussed a lot.
We sure did.
Yeah.
It was good
Yeah.
conversation for sure.
Yeah, I think we've covered a lot of good stuff, and I really am just, I'm happy to be here. I think this is an awesome show. I've looked at some of the YouTube videos and whatnot, so you're doing good work. So thank
Awesome.
you.
Thank you so much. I really appreciate that. Well, if people
Absolutely.
wanted to reach out to you, what is the best place for them to contact you at?
Yeah, so you can contact me at s.eleecreations.com at
Uh-huh.
gmail.com, sorry.
Mhm.
And then my website is lseleecreations.com.
Okay.
I am on at Instagram, so it's at Miss_Ely1, the number one.
Mhm.
And Twitter is just Lavette Shirley,
Okay.
at Lavette Shirley. So yeah,
All right.
lots of ways to reach me. If you just type in my name out, all my information pops up.
It really was that easy. When I was snooping around for pictures
Yeah.
and for bio information, I was like, "Oh, wow.
Right there,
Yeah,
yeah.
such a unique name that it's perfect."
Yeah.
Right, so everything will also be on Comfort Kills as well. Underneath our special guest, you're gonna see Lavette's picture, and then you'll see all of her contact information there so that you can reach out to her. If you wanna collaborate, you're a medical provider and you wanna collaborate on some of the different areas, you find that there's a need, there's an opportunity, definitely, I'm sure Lavette would love to hear from you.
Absolutely, please.
Alright. Well, thank you so much, Lavette. I had such an amazing time chatting with you, and I love that I had an epiphany moment in this very interview, and I'm
Yes,
just gonna start putting pen to paper really, really soon as I get off of here. So thank you so
fantastic.
much. It was
Thank
such a joy
you.
speaking with you.
You as well.